Hi, Nurse Kylie. I'd like to welcome everyone to Hive's COVID-19 recorded webinar with Nurse Kylie. She is on Instagram, WELLRN. She's also currently in the isolation unit at one of California's premier hospitals in the ER. We've grabbed her on one of her rare breaks in the last few days to ask her some of your most pressing questions. And we really hope that by making sure that we are only sharing real information from the front lines, that we help assuage you from all of that disinformation that is like just creating more panic and more disillusionment with what to do and how to protect yourself. So without further ado, welcome Nurse Kylie. So glad to have you during your quick break. First of all, we're so deeply honored that you're taking your little bit of time you have to speak to us and to answer everyone's questions, along with just so humbled that you are putting yourself on the front lines every day to help so many others. So thank you very much from everyone who will be listening to this. We deeply appreciate you and all of your colleagues there at the hospital.
Absolutely, you guys. And thank you guys for all your support. There's been a ton of people sending messages of thanks and well wishes for nurses. And we all really appreciate that during this time because it's getting ugly.
That is true. So can you just walk us through what you're seeing right now at the hospital? I know that people are still, one of the biggest issues we've talked about before is people are still showing up that haven't really, they're not high risk. They are just in a panic. Can you walk us through what people should do? I think one of the biggest questions is people feeling, I have symptoms, but I don't know when I should go to the hospital. Can you walk them through step by step when you should go to the hospital and what symptoms require hospitalization?
Right. So at this point, patients that have suspected COVID or any symptoms related to it are basically being diverted outside to a tent at our hospital. If they're really sick, they're being sent in through a back door with minimal access to get into a room, into a unit that is pretty separated from the rest of the emergency room. The majority of people right now, you guys, have very mild symptoms, and actually most do not meet criteria for testing. We have algorithms that we have to follow from the CDC. So if you're showing up just requesting a test, there is a high chance that you will be told, no, you do not meet criteria for the test. We have plenty at my hospital. I don't know what the stock is like at other places. So it's not an issue with the number of tests available for us. It's that we are trying to conserve them for when or if we do have that really big uptake. We have to reserve them for the really sick patients.
That makes sense. So can you walk us through what are the typical COVID symptoms? Because there's been some controversy. People will say they have myalgia, that they have sore throats, but then the CDC says those are not the top three. We've tried to clear that up at the Hive, that inflammation can show up for COVID in any variety of ways, and it basically looks like and feels like influenza, the flu. So can you walk us through in the hospital how you try and differentiate between the flu and COVID-19 patients?
So right now it's really challenging because we still have a ton of flu positive patients coming in. We're checking everybody with respiratory symptoms for the flu and RSV right now. Once they are coming back positive for those, if they do not have pneumonia, they're being sent home if they don't meet criteria for admission to the hospital. Right now, the people that are being admitted to the hospital with respiratory illnesses are being ruled out for COVID-19. To meet criteria for admission at this point, you essentially have to be septic and unable to maintain your own airway. There are some people who are just needing some supplemental oxygen support to help them through it, but for the most part, we're actually pretty limited on options for treatment. One of the biggest things with these patients with pneumonia is we can't do some of our less invasive measures for supportive care right now. We're not allowed to be aerosolizing, which eliminates nebulizer treatments, and it also eliminates BiPAP, which is a really non-invasive airway support system. So all these patients were having to intubate them and put them on ventilators to help them breathe in the meantime. I personally have, the patients that I have seen that are positive are not ill. I have not had a very, very sick COVID patient yet. We've actually had far more sick flu patients than COVID patients at this point. And this has not changed from October. We're coming off of a really, really busy flu season that had a lot of flu deaths. I work in an area with many, many, many elderly patients. And as of right now, we are still seeing far more flu patients and flu-associated deaths.
So basically, in a nutshell, if you start to feel that you have a sore throat, you have a spiking fever, you have shortness of breath, it doesn't mean that it's COVID-19. It could mean that you have RSV, which is a respiratory virus, or else influenza, the flu that is going on right now. It is just as, commonplace at the moment, probably, or even more so. But as we know, COVID-19 is growing exponentially every day, which is why you guys need to keep the COVID-19 test freed up for when we hit that kind of peak. Can you walk us through what are the exact symptoms of this pneumonia that they speak about with COVID, or even with influenza? It can be brought on, right? That's why they look so similar, and what people should look for if they're caring for a family member and they're nervous, but they realize that hospitals are germ incubators for COVID. One of the most amazing research papers I've read in the last 24 hours is one that was released by Wuhan researchers. They looked at 138 patients, and of the 138, nearly 45% of them, they got sick from COVID inside the hospital, both medical workers and people just in the hospital for other reasons. So that tells us hospitals are not the place you want to flee unless you have to. Of course, if you have to, we want you to go to them. So can you just really step by step, for anyone who's worried themselves, living alone, to taking care of a loved one, what are the steps to look for so that they can, ensure that they do not put themselves more at risk?
Right. So breathing issues are really the biggest thing at this point that we're looking for. You have to have your oxygen saturation checked. That's really the best way we have right now to see how well you are ventilating on your own. A lot of these patients that I'm seeing being admitted, their room air oxygen saturation is around 80 to 83%. Normal range is about 93 to 100 for a non-smoker typically. We don't put patients on oxygen in the hospital until they're at 92%. And there's a multitude of reasons for that. There's a lot of research done about too much oxygen actually creates free radicals in the body. So we don't want to oversupply oxygen in the body at this point. These patients also have really high heart rates. I'm talking 150s, 160s. Their blood pressure is also very low. These are all signs of sepsis, meaning infection has traveled through the bloodstream and is starting to shut down organs, which is when this really becomes dangerous for people. Those are the main things we're looking for. This isn't like, when I talk about shortness of breath, it's not the shortness of breath that you get just when you're on a jog. If you're up and doing something when you're sick, pretty much anybody is going to be short of breath at that point. This is shortness of breath while at rest. You cannot catch your breath. That heart is racing, that blood pressure is dropping. You cannot oxygenate yourself well. Your skin is going to become pale. Your fingers and toes and your extremities in some cases are going to start to become mottled and discolored because your body is really pushing all the blood towards the center of the body where all your vital organs are.
That makes sense. Well, that helps clarify exactly what to look for. Can people buy these oxygen saturation machines on their own if they want, if they have, we shouldn't go hoard them, but if you have people that are high risk in your family, if you are immune compromised, if you're on immunosuppressants, you might want to avoid a hospital, but also be able to better screen yourself.
Yeah, anyone can buy them. And in many cases, they're actually covered by HSA and FSA funds. You can find them really, really easily online at this point, and you don't need more than one, you guys. One is plenty sufficient for a family. Just clean it in between each person when you're using it. But otherwise, one is plenty.
Good to know. So I've been hearing people say, my doctor is recommending I come in for my annual screening, potential Botox. I've heard, I've seen some plastic surgeons say it's okay. We're washing down our offices. People have asked us a lot about go to a dentist's office. My personal dentist's office in Sonoma, luckily, is smart, and they said they're not seeing anyone unless there is an emergency, of course, and you can call the emergency number. But all of these doctors that are offering ozone, which you just said, ozone releases a lot of oxygen in the blood that can release a lot of free radicals that can actually do the opposite of what we want when we are horribly sick. So I'm hearing about people being encouraged to go spend a lot of money on ozone, insulation, as well as vitamin C IVs, because there were a few studies that the Chinese were testing out vitamin C IVs on people. And I've also heard that from a follower that in the UK, one of her friends has COVID-19 in the hospital, and she's being given a vitamin C IV. Can you speak to whether people should take it upon themselves to prophylactically do vitamin C IVs or ozone treatment, or whether it's safer to stay home at this moment?
So at this point, you guys, all non-essential doctor's office visits and laboratory visits should be canceled. I myself was scheduled to see my GP this Thursday, and I will absolutely not be going. I already received an email last week that all non-emergency and non-essential visits are canceled. So please do not go to your doctor's offices unless it is an absolute need. Most have the capability to do email and telemedicine now. That's actually been highly encouraged by the government today, which was a whole new release to be able to cover a subset of patients for telemedicine. So do those visits via phone, via email, via chat with your doctor. If you need refills on things, send it via an email. They don't necessarily need to see you for that. This is not just for your safety, it's for the safety of anyone else in that office who could potentially become infected and die from this. Dentist's office should be closed. That's a really open invasive procedure that we don't typically think about, because your mouth is wide open and hopefully your hygienist is wearing a mask, but you're still breathing into that person, and then he or she is then going to go on to the next patient and possibly carry something to the next person. I've also seen these emails from plastic surgeons that they're open and just putting restrictions on patients who've traveled. I don't think this is good practice. It's not modeling what restaurants, bars, shops, I mean, even places like Anthropology have shut down at this point in order to keep people safe. So I don't know how plastic surgery offices can justify staying open at this point.
Oh, I agree. I think it's selfish, greedy, and it's not flattening the curve.
No.
So let's speak about the vitamin C IV, because it's really going around. You have a lot of Instagram influencers that are, propagating it. We know that many of them get kickbacks from these doctors. So I really think it's important that, why we have you here, we kind of, break down the disinformation that it is safer to go get a vitamin C IV. I have heard so many Lymies, so many people with chronic Lyme disease, so many people that are immune compromised being told it's in their best interest by their current integrated functional doctor to go get a vitamin C IV.
So you guys, I'd be really cautious with this. Number one, we're not even supposed to be out and socializing. Why are you going to go put yourself, especially when you are immune compromised with Lyme and some other autoimmune conditions, don't go put yourself in a situation where there could potentially be sick people, not even to go get a vitamin C IV. The research isn't there yet. It's not strong enough. These are all just small cohort studies that are coming out of China. There's a lot of brilliant scientists and experts working on a treatment right now, but we cannot say that vitamin C is the cure-all. Again, these people in the UK that are on it in a hospital, they're probably part of an experiment, but it doesn't justify you running out and getting an IV and potentially exposing yourself or someone else to an illness for something that may or may not work. These studies are also not on prevention, you guys. These are for patients that were already infected. This has nothing to do with prevention. This is all about money and scamming people right now. We don't have treatments that are working, and experts themselves cannot agree on treatments right now.
So there's 3 treatments that we know of. There's a HIV drug that inhibits ACE2. There's also another drug that works as an antimalarial. They're being tested. if you happen to have access to these drugs, why should you not, give them to yourself? Can you walk people through that? Because I know a lot of people that get babesiosis, which is a type of, it's a parasitical infection, but it's, kind of has malarial types of symptoms in the body. People are given these, quinoins that are antimalarial. And I've been hearing rumors of people either stockpiling it or saying that they're going to take it upon illness. Why is that a bad idea?
You guys, these drugs are really, really strong and potent. You have to be using them with the guidance of a physician. We don't even know at what levels they're working at this point for patients with COVID-19. We have no idea what the numbers are. This is all experimental still. Let the scientists work on this that are really, really brilliant, far more brilliant than anyone on Instagram. Let them really get through the research on very sick patients right now and get the data out there. It doesn't help anyone to be hoarding supplies. Really think about what you're doing and how you could be potentially eliminating a drug for someone who's very sick on a ventilator right now by stockpiling your own year's worth of chloroquine. That's not safe. Also, the side effects alone from the drugs. How do you know you're not sick from a side effect if you start taking it yourself? You need someone to be monitoring your safety while you're on these drugs. You should never be self-medicating with these.
Yeah, you could damage your liver or your kidneys. You could actually, who knows, we're too soon into this disease to actually know that, there could be, viral, you could actually inhibit the virus or allow it to mutate more. You cannot self-medicate. And even though the Heal Hive is on Instagram and I am, we really, really try and make a point of not, increasing disinformation, but we're seeing it so much. You said you've been seeing it left, right, and center. There's a big rumor going out that elderberry, which is an immune supporter, is dangerous to take because it creates a cytokine storm in the body. I call BS on that. I also call BS on the fact that they're saying that ibuprofen is not good to take. Let's first talk about the ibuprofen part of it, because we know that it is a non-steroidal anti-inflammatory. It is being used, if I'm correct, in the hospitals right now, but then there's rumors going around that you should not use it. So can you walk us through that?
Sure. So with ibuprofen, you guys, we heard a lot about the French health minister saying to not use it unless it's, once you've already tried acetaminophen as a help for your fever. The study that he was going based off of was not a COVID-19 cohort of patients. It was a cohort of just simply respiratory illness patients. They did not discuss.
He made this statement about COVID-19, telling no one to take ibuprofen, which is a very powerful fever reducer that could actually help keep people out of hospitals. And he made this statement based off of not a COVID-19 study, but a random respiratory study.
Correct.
Can we make a correlation between a random respiratory study and a COVID-19 study? Are they
not at this point? No, not at this point. This illness is too new. We still need to figure out the ins and outs of it. People who shouldn't take Motrin already are people who have chronic kidney disease. Those people are already well aware that they should not be taking ibuprofen. People with certain heart conditions, they should also not be taking ibuprofen. My big question would be, in this respiratory study, did they consider that cohort of patients when they did the research? Were these people that already had kidney problems? Were they people that already had heart problems? This is not what's being discussed. You have to dig deep underneath the information. As of right now, ibuprofen is very, very valuable for reducing fevers and reducing symptoms like aches and pains and headaches and sore throat. We're absolutely using it in the hospital right now for people with fevers, be it flu, be it RSV, whatever it is, we are using it. Could that potentially change in the future as we have more COVID patients who are very ill and requiring more treatment? Absolutely. But you also have to remember the people that are becoming most ill from COVID-19 and ending up on ventilators are those who were already having heart problems, chronic health conditions. So you really have to consider these things and use those double-blind, placebo-controlled trials before you just generally spread broad statements.
I couldn't agree more. So we keep hearing these stories of these, younger people, 30-year-olds, 40-year-olds dropping dead to being, intubated right now in American hospitals. And I think that's raising the panic level for people, feeling that, wow, I probably, if I get this, I'm not going to get that sick, to, oh my God, I'm that age, it could happen to me. Can we walk through what are some of the pre-existing conditions, both known and also potentially unknown in people, that can lead to higher risk?
Mm-hmm. So I think some of these stories are being sensationalized, obviously. We still are working with a media who has to make some money on selling news. If you look at the actual numbers of people hospitalized from COVID-19 right now, they're not huge numbers. In my county alone, there's 10 people that are actually hospitalized with it right now. And this is in San Diego County. These aren't, I'm not violating HIPAA. These are numbers that are out on the CDC website. They're out on public health websites. So I can tell you guys, in the county, there's 10 people hospitalized right now that are positive. The value right now is 55 people that we know are infected. The number's probably higher than that. But again, because we have asked people to stay home with mild symptoms and not be tested, they're using computer algorithms to calculate that. These young people that are being hospitalized, I would ask questions. Were they smoking? Were they vaping? Did they use marijuana? Were they type 1 diabetics? What other underlying health conditions did they have that may have led to this? I know there is a doctor at Evergreen Hospital that's been hospitalized. He was, I believe, 44 years old. Was he a smoker? They haven't said that. Can doctors be smokers? Absolutely. Did he have type 1 diabetes? I don't know. Was it just from sheer exhaustion because he's been working hours and hours for weeks and weeks on end without sleep and tanked his immune system? Quite possibly. They're not talking about these things. They're latching on to one number, which is an age, and they're not talking about the underlying health factors. So we really have to keep that in mind.
That makes total sense. So, we shouldn't allow the media to get us hyped up about and make us fear-based, because that fear is, can you walk us through? So when we have higher cortisol, which is a hormone that is released when we get stressed, that kind of fight or flight response, it goes up. Cortisol also acts basically like an immunosuppressant. It's basically like a steroid in our body. And that immunosuppressant, what does it do to affect our immunity?
So you guys, as soon as you kind of kick your body into that fight or flight response, a lot of you have heard about adrenal fatigue. This is something that those people worry about. To when they do get sick, their immune system is shot because they've used up every last bit of steroid that their body had to support them, and then they crash from an illness. It could be something as simple as the flu that makes these people very, very sick. We know chronic stress in the body creates a ton of inflammation in general. It's going to irritate your heart. It's going to cause problems with your liver processing things through. Chronic inflammation is a killer. Stress is a killer of people. By focusing on all the negative news and continuing to contribute to chaos and panic, you are not doing yourself any bit of favors.
I agree. So let's talk through the high risks for people. So tell me if I'm wrong. So it is diabetes, people, not only diabetics, but have high blood sugar that are probably on the verge. High blood sugar is the biggest inflammatory, it will cause inflammation throughout the body, which is not what we want. Another thing is people on immunosuppressants. So people on, immunosuppressants for lupus or organ transplants, or, people with heart disease, respiratory distress like COPD. And then you mentioned also before biologics. Can you walk us through some of the high risk? And if you are high risk and you're living with people, most of us are living with people, how do we keep the high risk person isolated? And then we'll finish it off with talking about low risk, people like you and I that both have celiac, people that have autoimmune conditions or even infectious disease like chronic Epstein-Barr virus or chronic Lyme that might, suppress your immune system, but not necessarily lead to being a high risk patient. So can you walk us through that, please?
Right. So anybody that's got a history of heart problems or lung problems, and by lung problems, I mean anything from COPD, emphysema, a history of lung cancer, solitary lung, surgeries, fibrosis, any of those are considered lung diseases. Heart disease ranges from everything from high cholesterol to previous heart attacks, open heart surgery, stents. Those are all people with heart disease. Diabetes, you guys, we have so many people running around that are pre-diabetics or undiagnosed diabetics in the United States, just running around with chronically high blood sugars, or diabetics that are really poorly managed. Though, along with all of those three illnesses, typically comes things like obesity, unfortunately. So you are already at a very high risk for diseases and illness and death by having those conditions alone under the best circumstances. You throw a virus on top of it, such as COVID-19, you're putting yourself at a super high risk then. You're putting yourself at high risk every year, even with the flu for those conditions. That's why health and wellness is 365 days a year, you guys. It's not a 1 week detox. This is why we stress staying healthy all year round. For the people who are immunosuppressed and on these biologics, biologics are a danger no matter what time of year you're on them. I myself have been told I needed to go on Humira for psoriasis. I decided against that because of where I work, and it's not a good option for me who's exposed to many, many contagious illnesses on a daily basis. If you are someone who is on these immunosuppressing drugs or biologics for lupus, organ transplant, the many autoimmune conditions, ulcerative colitis, diverticulitis, all these people are on biologics now. You have to take very good care of yourself and stay away from people who could potentially be getting you sick. Myself, working in the hospital right now, I am not even doing anything near my husband at this point, okay? I 100% am staying away from him. We have not kissed, we have not hugged, we have not touched since last week before I entered into the isolation unit. We're sleeping in separate bedrooms at this point. My husband's very well and healthy, and I have no doubt he would recover perfectly fine from this illness, but because we do not want to continue spreading this throughout the community, and he works with many members of the community as well, we're taking every precaution and 100% staying away from each other. We're not even using the same bathroom at this point, you guys. That's how serious I am taking it to prevent us spreading it to potentially vulnerable people.
That is honorable of you and him. And, you know, that is exactly what we should be doing. My niece came from Europe, and we have put her into her own self-isolated house. She is young. She is not happy about it. She's going to be self-isolated for 14 days minimum. And it sucks. Mm-hmm. But why would we self-isolate her? Especially since if, let's say, potentially 70% of the people do come down with COVID-19, why is it smart to, quote, flatten the curve even within our own household right now? I would love for you to explain that, because, you know, for us, it was hard for me to convey that to my own family, how important it was for her to be self-isolated, because they're like, well, we'll all get sick anyways. What does it matter? And I needed to explain why it matters. So can you, like, from your, you know, medical superiority, give us the rundown of why it is so important, if you know anyone who's been in a high-risk situation, that you must do everything possible to ensure that they do not come in contact with the rest of your family at this moment?
Mm-hmm. So you guys, flatten the curve is really all about not having that really high spike in patients that we're seeing in Italy, where the hospitals are inundated and overrun. It's not changing the volume of patients necessarily that will get it, or people that will catch the virus. It's simply spreading it out over a longer period of time, but also it could potentially decrease the number of people that actually catch this. We know this because China put in very strict containment measures, and it's actually amazing how few people caught this illness in China, considering how many people live in Wuhan at this point. It's pretty amazing. They didn't do great at keeping it from spreading around the world, but once it's contained, it's contained. So by keeping people separate, you don't have hosts for this virus. Again, you guys, it's not necessarily about the young and healthy. I know on my webinar at the Hive last week, I said, if I had vacation time, I would love to take advantage of these cheap plane fares and hop on a flight to Europe right now. But it's not about me. It's about protecting the people who are most vulnerable and sick at this point. I wouldn't go and visit my own grandfather for the next few months. He doesn't live near me, so I don't really have that option, which is good because I want to protect him. He's got a lot of those underlying health conditions. Keeping those young and healthy people away from the elderly is so vitally important at this point to really flatten that curve. Maybe the illness only stays with them at that point and it doesn't continue on. If that one person infects their entire family, those people then go out and infect 4 more people each. They've got calculators for this. They know how contagious it is. So by keeping people isolated away and contained, you're stopping that spread of the virus. There's no host for the virus to continue on into.
And I think what's really important for people to understand is the reason you want to avoid hospitals, if you can right now, is because of this, is because it is probably at the hospital. Do you guys have any sense of when the peak is going to be?
We don't know. We're prepared for it as best as we can right now, but we really don't know when it's coming. We're hoping that taking these extreme measures right now, and that if the public can really start to follow them, that it will actually prevent that crazy peak that they're seeing in Italy right now. A lot of people are not taking this seriously, you guys. If people are still not taking this seriously, I urge you, don't be mean to them, but really try and educate them on why it's so important that they should not be out in the community. Perfectly well, people are still coming to the hospital simply to get a test right now. You don't win an award for testing positive for COVID-19, you guys. Your award is being stuck at home for 14 days and being monitored by the health department that you're not going anywhere and infecting anyone else. We don't have a magic pill. There's nothing we can do. So if you're not sick, please don't come in.
Thank you. I've been hearing a lot of rumors, people saying that, oh, if I go into a sauna, it will kill the virus, to if I drink hot water or if I use a neti pot and clear out my nasal cavities, it will protect me. Can you talk about those prophylactic prevention mechanisms and whether they are useful?
So you guys, going in a sauna is not going to kill this virus. You can be in as hot of a temperature as you want, and maybe the virus won't survive on the surface, but once you already have it, you have it. It will not get out of your system faster by doing sauna. Inhaling hot air does not kill this virus. Your body actually won't allow you to inhale this scorching hot air. It'll cool it down to an appropriate temperature for you. Flushing your nose out. I've never been a fan of neti pots. I've seen patients who get really bad infections from neti pots because they're not properly cared for. So you're actually potentially introducing a pretty and potentially deadly bacteria up into your nasal passages and into your sinuses by using a neti pot. You cannot just flush out the virus via a neti pot. If all that worked was water to flush it out, this wouldn't be an issue for anybody anymore.
That's what I say. So we're both celiacs. We both have, just by merely having an autoimmune disease, are higher risk than someone who doesn't have one. You work as a nurse. You have been in the isolation treatment area for COVID-19. As a nurse with celiac, someone with an autoimmune condition, a common autoimmune condition, for people with things like Hashimoto's, Graves' disease, Ehlers-Danlos, even potential infections of Lyme or co-infections or chronic Epstein-Barr, what do you say to them? Because they are going, okay, I'm immune compromised. I get sick, if someone sneezes a block away, what do I do?
Mm-hmm. So you guys, take all the normal measures that you would on a daily basis to protect yourself from illness. Again, containment is really important at this point. If you're someone who's really worried about getting sick, don't go out in the community because it's highly likely you're going to catch something, even something as simple as the common cold. It's still going around this year. Flu is still very contagious this year right now. Take your normal precautions of using extremely good hand washing, doing that 20 seconds at a time. If you touch stuff at your home, make sure you're washing your hands right away after touching it. We don't know how long this virus is living on surfaces at this point. A lot of that is still very up in the air, and a lot of research is being done on it because it's really important for infection control at hospitals. So we just don't have those numbers yet. So just practice really good hand hygiene. And if you absolutely must go out in the community, try and go out when you know the volumes of people are going to be a lot less, really late at night, and wear a mask if you're going to be out there.
That is really amazing advice. So what if you do have, like, let's say an N95 mask or an N100 mask? What would you recommend people do?
So as of right now, those masks, you guys, we really need to conserve them for healthcare providers. There is still a lot of kind of back and forth in the medical community as to whether this is an airborne virus or if it is just droplet. The flu is considered droplet. So right now, because there is no consensus, we are needing those N95 and N100 masks for the hospital. If you are not someone who's in direct contact with a known COVID patient, you can get away with wearing a surgical mask out in public at this point, especially when you're practicing social distancing. Ideally, nobody is out in public right now, you know, spreading their illness, but we know it's going to happen, which is why it's important for everyone else to really stay home and avoid those peak times when people are out and about. N100s, really, you guys, they should be reserved mostly for the people who are actively caring for these patients with known COVID-19.
If you have an extra mask, should you stop and drop it by your hospital, or should you call the fire department if you just stockpiled and you were one of those, you know, first people that thought it was going to get so bad, like me, as I've already offered you my few N100s. Not that I was meaning to hoard. I just thought I was paranoid a month ago, and now I feel clairvoyant. What would you say to people like me that, you know, want to be a really good citizen right now?
So the hard part, you guys, is we can't accept things at the hospital because we don't know where the masks have been. We don't know if they are contaminated at this point. We are having to throw our N95s away between each patient that we are contacting because we don't know if we're potentially passing this virus via even wearing the mask again, which is, you know, so we just, as much as we would appreciate the donations, we just can't accept them at this point.
For everyone who wants to help first responders, nurses, and doctors, I know for me, I sent you some liposomal vitamin C, I got you some food delivery, and I sent you some bone broth. If you know someone who is working, you know, night and day as a first responder, what can you do right now to help them?
So one of the biggest helps for people would be right now, try and get some food delivery for them and leave it on their front porch. If you have access to CSA boxes, that would be hugely, hugely helpful. I know there's a local CSA right now that's actually offering a discount and to drop off deliveries directly to medical providers' homes with proof of their ID. So if you can buy a CSA box for a healthcare worker or an EMS worker, that's so valuable right now. We still need fresh fruits and vegetables. We've had people send pizza to the hospital. That's super, super generous. But you guys, we are working with the sickest of the sick right now. We really need immune supporting foods also. I myself can't eat the pizza anyways, being celiac, and I avoid dairy typically. So we are so appreciative, but really those healthy foods are super helpful for us. Protein bars that haven't been opened, stuff like that is really amazing at this point for healthcare providers because it's a quick and easy thing that we can grab.
So an organic, gluten-free, vegan type powder that they can just come home exhausted and make, at least get some protein in, protein bars, you know, dehydrated bone broths, even frozen bone broths, things like that. And if you can get your hands on some vitamin C and such like that, that would be really, really helpful. I know for you, you asked me for some brain elixir, Beekeeper's Naturals to keep you going, and some propolis. I mean, you were just saying that you guys keeping up your food foundation is so important. Can we talk about, like, you know, that it's not just for the next 14 days if you feel like you got exposed, and it's not necessarily for the next 8 weeks. This could be going on for quite some time, and it might not be as restrictive travel and such for, as you know, as many as 2 or 3 months. It might, but it's us keeping an ongoing healthy habit of boosting our immune system. What are your top 3 ways to boost an immune system?
So right now, you guys, what I'm doing that's super, super important is I'm trying to get as much sleep as I possibly can. I know that when I don't sleep enough, I get sick. It's just my body, and I'm sure it's most people's bodies. We know how vital sleep is. I also am not doing any crazy new detoxes or adding anything crazy to my regimen that could potentially mess with my immune system. I know that I have a good, healthy immune system, and I'm continuing to do the things that I normally do to support myself, which is vitamin C, my daily multivitamin. I'm taking my fish oil. I'm eating good, healthy, and clean foods that I always eat. You know, I have a freezer full of deer meat. I'm very lucky. So I have a really good, clean source of protein. And the other thing is I'm practicing my normal good hygiene right now. I'm doing tons and tons of hand washing. I'm wiping down surfaces at my own home because as much as I'm careful, I was in kind of the pit of illness. So when I come home, I strip my clothes off completely, get naked in my garage. I have a laundry basket set aside in my garage for when I am out in the community. All those clothes go straight in there. No shoes come in the house. And then I then go straight into my shower and I'm scrubbing with bar soap as much as I can right now.
So would you recommend people take off their shoes outside before entering the house?
Absolutely, 100%.
What if you have a family and that you're designating one person to go to the grocery store? What are the healthy habits that they can use? I've been recommending for everyone to literally take everything out of the cardboard from the grocery store, wash with soap and water all your fruits and vegetables, the outsides of the containers. If the containers are cardboard, you take what's inside the container out and hopefully it's waterproof and wash that. If it's not for any reason, let's say it's pasta in a cardboard container, I'm leaving it on its own in the bag in my garage for 72 hours before I touch it. Now, I know that some of the studies are still they're still pending. We know that it lives on surfaces, but if you are that one designated person that leaves the house, what would you tell them? I'm saying to my husband, he has to change his clothes. Mm-hmm. He has to not walk in the house with shoes on. We're cleaning everything that comes in from the pharmacy to groceries, just wiping down every surface, as you said, and making sure that the bathroom is also really, really well cleaned, because we do know that if you do have the virus, it is not only shed in your respiratory system, it's shed in your gastrointestinal shedding of the virus. So it's really important to keep the bathrooms as well super, super clean, especially when you're living with people. So what are your go-tos for people to say to the designated one? I think everyone should have a designated person who goes to the store. Why? It's not that we want to make sure that you don't get out and about, which we do, but for your own sanity, I understand. But that one person can start to practice these habits and it will become rote to them over the next few weeks, where it's going to become second nature. Whereas we all, take turns going out, we're going to forget and accidentally touch our face or accidentally come into the house with our shoes on and not take our shirt off. And all it takes is that virus getting on your sleeve, and then your sleeve touches your baby, and then your baby might not even show symptoms and then might give it to your elderly grandparent, et cetera, et cetera. That's a domino effect. So can you walk us through how, what will you tell the people who are in a shared household? And I think this applies to if they're getting groceries delivered or food delivered, right?
Yeah. So guys, just make sure you're wiping everything down really well. Brooke just gave you a whole bunch of amazing tips and tricks. Those are perfect for everybody. I know we talked last week about just even using soap and water rags. If all you have is dish soap on hand, get some soapy water and dip your rags in it and wipe everything down really well. Scrub it off. Friction is really important for getting rid of viruses, not necessarily bleach. It's that friction, which is why we know just plain soap and water works amazingly well for hand washing. As far as having one designated person, I would try and choose the healthiest person in your household, because they're a lot less likely to become sick, and then you're not going to have to switch to another person who then is going back out in the community before you go down the line of having that elderly person having to risk going out there. Again, avoiding those really peak times when people are out and about. We know midday, people are really bored. They have kids at home. They're trying to run out and run errands. Don't go out in the middle of the day if you can avoid it. Wait until 10:30 when those grocery stores are closing, and run in and grab what you need to. Again, wiping everything down as much as possible.
Those are amazing tips. So we went over eating healthy food, trying to get your fruit and vegetables in, taking your vitamin C. It is an immune booster. What about this, staying away from elderberry? That's a big rumor going around.
You know, I really don't know enough about that at this point. I personally don't use elderberry in my daily practice. I never have, even during the peak of flu season. I know some people really love it. I think the research just isn't there supporting it one way or another, saying do or don't take it. I don't know if they have the time to put into elderberry research at this point. I think they're a lot more focused on vaccines and finding treatments that work. I can't speak to what's going on with elderberry at this point, unfortunately.
Neither can I. Another question we had come up, and I will let you go because I know you have to get back to the hospital really soon. But people have said, I'm pregnant. I know that I am immune suppressed. And that is complex with pregnant women because they are both immune suppressed and also they have an overactive immune system. Have you had anyone pregnant come in with potential COVID-19 symptoms? Are they treated differently? Are you more worried about them in the hospital? Or do you think that's overblown at this moment?
So at this point, I personally have not treated any pregnant patients with potential COVID. You guys know I work with a lot of young nurses, so we have a lot of pregnant nurses right now, including one that's pregnant with twins.
Wow.
We are trying to keep those nurses away from the isolation unit at this point, and staff is very supportive of that. I brought that up immediately when this became an issue. I said, look, I'm not pregnant, but I'm worried about our pregnant staff. What are we going to do to protect them? So they're really trying to keep them away from that isolation unit and just keep them more with the general patients that are coming in for your everyday standard emergencies where we know they're not going to be as exposed to these illnesses. Also, when you're pregnant, you're already very short of breath. It's hard to breathe in those N95s under the best of circumstances. Let's not put pregnant patients in N95s as much as possible.
What if you have a child that gets sick, spikes a fever, and has trouble breathing? I know that parents are much more concerned about their children than they are sometimes about themselves, and that can really, really raise a parent's panic. What would you say to them? Because I think it's harder to monitor children.
Yeah, kids are really hard. So a really common illness that we see every year in kids that causes fevers, high heart rates, high respiratory rates, and a lot of difficulty breathing is RSV. And we're actually seeing that a lot more in the adult population this year too. It's a really, really common thing. Many, many kids are hospitalized with RSV every year. As of right now, I know pediatric hospitals are set up with swabs. They are swabbing kids for RSV and the flu, and they are checking kids for COVID-19 right now. Just be really conscientious, watch your kids breathing. We usually will look for retractions in children, which is where kind of their skin is pulling in between their ribs with every single breath. They'll do a lot of really heavy abdominal breathing and their skin will become pretty mottled when they're having significant trouble breathing.
Okay, that's really helpful. So if you see any of those symptoms, that's a time not to run to the hospital, but probably call emergency services, right? And tell them what your child's conditions are and see when is the best time to bring the child to the emergency room or have 911 come pick up that child.
Correct. And at this point, you guys, anytime you're contacting 911 and you're worried about a potential exposure, make sure you let the dispatcher know that. We have had a multitude of EMS personnel exposed at this point because people were not forthcoming about their travel. They were not forthcoming about illnesses and symptoms. We've seen this in LA County already. They released a big, huge thing about their firefighter being exposed because of a patient who actually ended up dying from it. So again, this is all public knowledge. You guys really watch for those public notices and please, please, please follow what your public health departments are asking of you.
Trust them now because they want as many people to stay healthy. There's no conspiracy here. No one wants you guys in the hospital. No one wants you dying and filling up the morgues. So listen to them over lots of really, questionable people on the internet. One more thing before we let you go is supplements. Is that we talked about vitamin C. We know that vitamin C is an immune booster. Are there any other supplements that you recommend or that you're taking for yourself right now?
So my personal supplement regimen is high dose vitamin C, a daily multivitamin, which is a liquid one because I tolerate it better. I always eat collagen every day. I take really high dose fish oil every day. You guys, I swallow 4 grams of liquid fish oil. That's totally disgusting every single day. And that's the best things I can do to support my immune system at this point, along with getting enough water and adequate sleep. Hydration is really important for keeping things moving throughout your body and supporting your body's own detox pathways. I would love to be able to add in coffee enemas at this point. I don't think I'm going to have the time for those. But just keep on doing what your normal daily immune supporting things are along with food. I'm a huge, huge fan of getting your nutrients through food, which is the most bioavailable way for your body to use these nutrients.
I agree. Is there any last words, because we might not talk to you for a few days, that you want to impart all your wisdom to everyone listening?
Yeah, you guys just remember, please, we're not trying to be draconian about these measures. We really are trying to help the people that truly, truly need it. These are good reminders for just every day not to bog down hospitals. Remember, there is still normal emergencies happening every day despite a pandemic, stuff that has nothing to do with the virus. We are still getting lots of patients with heart attacks, strokes. Well, we might even get even more now because of the stress people are under. People with appendicitis, ruptured organs, traumatic injuries. These things do not go away despite a pandemic. So you really have to keep those beds open for those people that will end up needing them, not just people with COVID-19, but these people that still have real, true emergencies. So please don't inundate hospitals unless it's absolutely necessary. I know the testing and everything that is really frustrating right now for people, and you want to know that you'll have access to a test if needed. I can promise you that if you are someone who is admitted to the hospital, you will be tested for the virus. If you are someone who came in just requesting a test, you may not receive it, and please don't be mad because there is a very strict algorithm that we're following right now. This is not up to the healthcare providers. It is coming down from the CDC directly in order to preserve these tests. Not everybody has to be tested. They have computer models that can tell us exactly how many people they are estimating are actually infected. We're just kind of waiting for those numbers to roll out.
And that's something we should speak of before you leave, is that a lot of these computer models we're seeing are computer models created by the media, not necessarily with these. There's these like amazing computer scientists that work in medicine that create these algorithms that literally, you know, John Smith, Susie, you know, Sarah, Daryl, if he takes himself out and he doesn't go to the concert, we'll change the algorithm. If Susie doesn't go visit her grandmother, she changes the algorithm. If, you know, Smith doesn't go to work, he changes the algorithm. All of these things are constantly shifting in an algorithm, and these algorithms are, you know, massively smart. They use AI. They are computer modeled sometimes from scientists that you know, spend years and years on them. We are still waiting for all those to come in. But just because you see a log algorithm done by the media, which is kind of like, this many people get it, this many people die, does not mean that that is necessarily a correct algorithm. And if I have time, I'll go into algorithm science, but it's kind of complicated. I'm not an algorithmic scientist, but I think you agree the algorithm you're talking about is highly complex, and we're still figuring that out at the moment.
Absolutely. And you guys keep in mind also the numbers for death rates right now are based on confirmed cases in total. So there's probably many more people infected that were not confirmed positives, and that's where we're going to have to rely on these algorithms. So those death rates are probably going to change statistically as we move on, and we just have to be flexible with those numbers. Don't latch on to one number, just know that it's flexible. We use these computer algorithms every single year for flu tracking because we know we capture maybe about half of actual flu cases in medical facilities.
That's
so
crazy.
Just really be careful about the information that you're consuming. Take the time in quarantine to sit and enjoy and read books maybe instead that you've been neglecting. I would love to sit and read a book right now.
And exercise, that's going to boost your immune system, right?
Get outside, you guys.
Outside.
Walk, get some exercise. There's so many things you can be doing outside, not near people.
One thing I need to mention is that I have seen people outside keeping to themselves, saying 6 foot distance, and then at the dog park, they'll touch other people's dogs. And I'm like, oh, don't. Not that the dog can carry the virus, but their fur, if they're kissed by the child who is asymptomatic but shedding the virus. So maybe it's in my head, this is not scientific, but I'm like, don't touch other people's dogs right now. This is not the time to say hi to Fido. What do you
Yeah.
recommend that?
I think we just don't know the research yet on whether we know that dogs can't carry the virus. That was scientifically proven.
Thank God.
But, you know, I think anytime you're petting other people's dogs, you don't know where they've been. So always good to practice really good hand hygiene.
Exactly, and dog hygiene. Okay,
Yes.
Nurse Kylie, we love you. If anyone is DMing her on Instagram at the well-RN, just know that she's probably busy saving lives, but that when she gets breaks, she reaches out to us and gives us updates through the Heal Hive, and I share them on Everyday Expert on the Heal Hive. So we are so grateful for you, so thankful for you, Nurse Kylie. You stay safe, and you know, as much as you can update us, I know everyone is going to love this and we appreciate it. So thank you.
Absolutely. No problem. Stay safe, everybody.
Thank you, Kylie.
Bye-bye.